You guys, anyone that knows me knows that I am, as I told you, I'm a gynecologist, but I also am a big, I specialize in anti-aging, and I do treat both males and females with testosterone. I'm probably am one of the top testosterone pellet providers in Central Florida, and definitely within Lake County where my office is. And I've been doing this for years and years and years. And so I'm obviously a very pro testosterone person, bioidentical testosterone, which is similar to what your body naturally produces, has many, many benefits that I have known for years. And one of the latest things was that just got released from the Journal of American Medical Association was that low testosterone levels, or you may have heard people call it low T, are is definitely seems to be linked with severe COVID disease. So we've known since the beginning of COVID, it appeared that men were more wimpy when it came to um, the disease, and so we noticed that men were more likely to become severely ill and were more likely to die. And doesn't mean that there aren't females dying every single day from COVID. I'm not saying that, but we did see that data. We did see that there seemed to be an increased trend as far as hospitalizations, ICU admissions, and deaths. So now what they're saying, they're going back and they're looking, obviously trying to understand what could be causing this. And so one of the things that they started delving into was testosterone. And at some point, somebody was thinking that there was a thought that it was actually making um, uh, COVID-19 worse. Well, they've done studies now, and they're coming back and saying absolutely just the opposite, that the lower the testosterone level, actually, the higher correlation with being severely ill, ending up with the ICU, and also dying. So they had 89% of men who were hospitalized for COVID-19 had low testosterone levels. Testosterone levels, it depends on the laboratory that you use, but usually overall, a level of 250 to 1100, so it's a huge range, is considered normal. So these men were coming in and they were having levels that were significantly lower. And a level of about 53 was definitely associated with severe disease. So the lower the levels, the worse the potential outcome. Now, there's a caveat to that because stress will affect your testosterone levels, and they have actually shown in the past that men that come into the hospital, even if it's for an elective surgery or if it's for like a heart attack or a stroke or anything like that, that their testosterone levels do plummet. So, kind of not 100% that, which comes first, right? So, meaning um, they're going to have to do a little bit more research, and they would have to actually study men that are not in the hospital first to find out whether or not um, just the hospitalization itself was also dropping the levels. So if you follow what I mean, did they come in? Did they have low T before they hit the hospital doors, or was the low T part of that? But obviously, if you're dropping your levels, even if you drop your levels 50% just from the stress of hospitalization, if your levels were high, you're still going to drop down. If you're at 1,000 and you drop down to 500, you're still in the normal range. So you have to have at least started off at a fairly low level, even if it's a low normal level, in order to drop down severely low, if that makes sense, if you're following me. So they are definitely, now, for women, not the same. They haven't found that testosterone levels, estrogen levels, progesterone levels, any of the other hormonal levels that are prominent in women, um, and or any of the other levels in men, seem to have any correlation with COVID, for better or for worse. But I think that this is something that's promising. It's treatable. There's many other benefits to testosterone, as you know. Now I'm talking about bioidentical testosterone. I'm not talking about synthetic or man-made testosterone, that has been linked with some negative things, as well as not with COVID. I haven't seen that data, but as far as like cardiovascular disease and stuff like that. So please be clear that all, I guess, testosterone, shall we say, is not the same. But that's very promising and something that can be easily, just like we talk about the vitamin D, we talk about boosting your immune system with other, with being on good multivitamin, being on D, being on zinc, being on magnesium, eating correctly, sleeping. because that's when you rejuvenate. And I'm not the best when it comes to that sleep one, as anybody knows. I am a closet vampire, but definitely quality sleep does reset your immune system, and it also is a very good de-stressor. So all of the things that can boost your immune system, we definitely want to look at that. But having, if you are a man, and especially if you have any other comorbidities that would increase your risk for having a bad outcome with COVID, then definitely you may want to go ahead and just get checked out and find out whether or not you have low T. And like I said, there's so many other benefits that go with improving your testosterone levels. So it's not just COVID, but this just is something else to reinforce to say, hey, it's worth getting your testosterone levels checked and just getting a full checkup from your doctor to make sure that you are that your hormone levels as well as your vitamin levels and your heart, your lungs, everything else is the best that it can be. So that's what I have for you guys this week. And if you can think of anything else, feel free to let me know. As we know, the CDC has relaxed mask mandates. For anyone that has questions about what's going on in our office, the recommendation still by the CDC is that that healthcare facilities still um, mask, and so we have maintained mask in our office, but our office is 95% COVID proof for anyone that has any concerns. So you can feel comfortable coming into the office. But yes, we at this point, until we have further guidance from the CDC telling us otherwise, we are still masking within our office. We still do the telehealth on Mondays and Fridays. And if anyone is interested in learning more about testosterone, etc., and whether you're male or female, certainly that is something that I am certainly available for if you were interested. So we are going into Memorial Day weekend. I'm actually going into vacation, so I'm really excited about that. It is time. I need it, and it's going to be very nice to be able to walk around. Even though Florida's been in full reopen, just feels more freeing to be able to just really feel like you can let go of those masks and feel safe, um, and not concerned that that you're waiting for that um, other foot to drop that you may develop COVID. So I'm going to have a good week, and I hope that you do too. As always, stay healthy, stay safe, stay beautiful, and I will see you guys next Friday at 4 p.m. Take care.